Hi friends, today we are looking at disorders over the gallbladder. The previous week we were talking about the disorders of the spleen, and we benefited a lot to see how we can manage those disorders. And today we are looking at another condition, which is disorders of the gallbladder, and pay attention as we are going to go through. First part, we are going to talk about its anatomy, and we are going to see some of the conditions that actually affects the gallbladder and how they can be managed. Straight away, let's talk about the locations and any part of anatomy of this gallbladder. So we're seeing that several disorders that affect the biliary system interferes the normal drainage of the bowel into the duodenum. This gallbladder that we're talking about, it is the storage of the bile, which is secreted from the liver, so that it can be distributed into the duodenum to aid in the digestion. And we are saying that much of the disorders that could affect the biliary system, which is the very gallbladder, it means that it will interfere with the drainage of this bowel. And these disorders include mostly the inflammation of the gallbladder and also the overgrowth that can be the carcinoma, and it also causes the obstruction of the biliary tree, which disrupts the flowing of the bowel. So the gallbladder diseases with gallstones is the most common disorder of the biliary system, and today we are going much to concentrate on the gallstones that have been said to be the most common disorders of the biliary system. So the gallbladder, in terms of its anatomy, we are saying that it's a P-shaped organ which is found just beneath the liver, because we said that it stores the bile that is secreted from the liver, so it is just found just under the liver, and it stores the bile, which is the fluid made by the liver, to digestive system, just like it has been already mentioned, and its function is actually to aid in the digestion of the fats. So as the stomach and intestines digest the food, the gallbladder releases the bile with a stimulation that actually sent to the bladder, and then when that information stimulates the gallbladder, it is going to release the bile through the bile duct. So the duct connects the gallbladder and liver to the intestines, to the small intestines to be specific, where it is actually used as the helper in the digestion of the fat for them to be absorbed. So here we can see the visual aid of the anatomy of the gallbladder. So we can see the link that is there between the liver, the gallbladder, and also the small intestines. So that's where the gallbladder is actually located. So the normal function or the normal physiology of the gallbladder, the first thing, just like it has already been mentioned, it actually normally the bile, it is formed by the liver and is stored in the gallbladder. And this bile that we are talking about as the fluid or the pigment, it contains the bile salt, it contains the bilirubin, it contains water, electrolytes, cholesterol, fatty acid, and the lecithin or lecithin. Yeah, quite right. So these are some of the contents that actually makes the composition of the bile that is stored within the the gallbladder. So in the gallbladder, some of the water that is contained within the composition of the bile gets to be reabsorbed in the blood vessels, leaving the fluids and the contents that is being left in the gallbladder be concentrated. So when the food enters into the intestines, it stimulates the gallbladder, and the gallbladder is going to contract in order to release the bile through the bile duct and also the sphincters of the Oddi into the intestine. So when we talk about the sphincter of the Oddi, this is just the sphincters that are found, or rather that the smooth muscles that actually surrounds the bile duct as it is connecting into the intestines. So its function is actually to regulate the flow of this bile into the intestines. So when it opens, it means the bile is going to flow through into the intestines in order to be used in the digestion of the fats, just like we have already mentioned. And the bile salts' function is actually to increase the solubility and the absorption or the fat that are actually being digested within the intestines. So remember, we're talking about all those contents that are found within the bile as the pigment that is secreted from the liver. So the types of the bladder disorders that we are going to talk about now in this case, just like we have mentioned, we said the number of disorders that can affect the gallbladder. But today we are going to talk about much of those common disorders. There's cholecystitis. When we hear the term cholecystitis, we're actually talking about the inflammation of the gallbladder. And this inflammation can be influenced by a number of factors. It could be infection, it could be obstruction that can occur within the biliary system, and other underlying disorders that actually leads to the inflammation of the gallbladder. And when this inflammation occurs, you are going to see some signs and symptoms of inflammation, like the pain that is going to be felt, that is going to be localized in the right quadrant of the abdomen due to the location where the gallbladder is located. And also there will be the increase in size, there will be the distension of the size of the gallbladder due to the fact of the accumulation of the fluids as a result of an inflammation that has occurred. And also we are going to see number of signs and symptoms of impairment in terms of fat absorption that is going to rule for the presence of an inflammation of the gallbladder. And also another condition, it is cholelithiasis. Cholelithiasis, in this case, we are just talking about the formation of the stones within the gallbladder, which is said to be calculi. Calculi is the stone formation. Now in the gallbladder, that's what we are saying, cholelithiasis. Now let's talk in details about cholelithiasis as being the most common disorder of the gallbladder. So you're saying that the gallstones or the cholelithiasis, just what we have talking about, it is the crystalline substance or stones that are going to be formed within the gallbladder due to the acceleration or the high concentration of the cholesterol and other contents that are found within the gallbladder. That is going actually to form the aggregation of those substances and forming some insoluble and hard substances that are going to be said to be the stones in this case. So actually, when you're talking about these stones in the biliary system, they can actually be found on different locations, as the whole length of the biliary system is not only confined in the gallbladder as the storage of the bile, but also in the ducts that actually aids in the flowing and the draining of those bile can also be obstructed with these stones that we are talking about in this case. And the obstruction of the bowel system or the bowel tree, the biliary tree, because of these stones is what we call choledocholithiasis. So when you're talking about choledocholithiasis, in this case you're talking about the obstruction that is going to happen within the biliary system due to the presence of the stones that have been formed. And this obstruction can lead to jaundice. Jaundice in this case is just a condition that comes as a result of the excessive breaking down of red blood cells, and this is going to increase the amount of bilirubin. So when this bilirubin keeps on circulating within the blood vessels, it is the one that is going to result into the yellow discoloration of the membranes, like in the eyes you are going to see the membranes of the eyes going to turn yellow. You are going to see the tongue, the palm, and all those other membranes turning yellow due to the fact of the increased levels of bilirubin within the blood vessels. Here we can see what we are talking about. So just like you have mentioned, these stones can be found at different locations, not only in the bladder. So you can see on the left hand side we've got the gallbladder that is having the stones that we're talking about, which is cholelithiasis. And we can also see the duct having the stones. When it is part of the liver, it is going to be called as a hepatolithiasis. Hepato from the liver, and lithiasis, the formation of the stones. And also we are going to have choledolithiasis. In this case, choledolithiasis, we just said that this is actually the obstruction of the biliary system or the biliary tree due to the fact of the presence of the stones. So we can see the stones obstructing the biliary tract. What are the types of the gallstones? There are actually primarily three types of the gallstones that can be detected in the cholelithiasis. The first one is the cholesterol stones. When you're talking about the cholesterol stones, actually, primarily, before you can talk about the cholesterol stones, what has to come into your mind is that most of these types of the stones that we'll be talking about, they are named after its cause. So cholesterol stones, actually these are the stones that are known to be caused by the high concentration of the cholesterol within the gallbladder. So actually in its appearance, when it is viewed, appears green and sometimes yellow or white in color. So it is caused by the presence of high concentration of the cholesterol. The second type, it is actually the pigment stones. The pigment stones in this case are the stones that are caused by primarily the increment in the levels of bilirubin and the calcium salts that is found within the bile as part of its content. But due to the hyper concentration of this can lead to the aggregation of those substances and forming the crystal-like substances that are now in this case the stones. And its appearance appears to be dark stones. And we also have the mixed stones that are also said to be pseudoliths or fake stones. In this case, they are not primarily made up of the cholesterol or rather the pigment, but sometimes it can be mixed. Both they can aggregate together and forming these stones, or sometimes they can be just the overgrowth that or the substances within the gallbladder that are going to aggregate together and make the crystal-like substance that is going to form the stones that can even result in the obstructions of the biliary tract. So this is what we are saying in this case. So it could be cholesterol stones, the pigment stones, or the mixed stones. What are the predisposing factors to this cholelithiasis, or the formation of the stones within the gallbladder? The first one, it is the age. Age can predispose an individual to the production of the stones within the gallbladder or in the biliary tract. In what sense? Due to the dysfunctioning of the liver and the other, just the systemic processes are going to be altered as the person is advancing in age. So we're saying in this case there will be the dysfunctioning of the liver, whereby there are high chances of increasing the hypersecretion of the cholesterol that can result in the stone formation. Sometimes it could be family history gallstones. It is genetically inherited, whereby it runs in the families. They've got the impairment in the biliary system, whereby it can result in the formation of the stones. Sometimes there can be obesity can also predispose an individual to the gallstones. In what sense? There will be hyperlipidemia. Hyperlipidemia, in this case, you're just talking about the increase of the high levels of lipids within the blood as it is circulating. So the lipids, it is known to have a certain amount of cholesterol, and it is also linked to the increase in the cholesterol. This cholesterol, when it increases plus that of the liver, it can causes the stones within the biliary system. And also the rapid weight loss. Rapid weight loss, in this case, it is going to stimulate the liver to over secrete the cholesterol that can result in the aggregation and forming the stones within the gallbladder. The female and gender due to use of oral contraceptives. In this case, these oral contraceptives are synthetic hormones, which are estrogen and progesterone. And estrogen, it has the mechanism of increasing the levels of cholesterol, and this cholesterol is the one now in this case that we're talking of having an impact in the formation of the gallstones. So the female gender, it is at a higher risk of developing this due to the presence of estrogen, more if this female is at oral contraceptives. And the biliary stasis, pregnancy, fasting, prolonged parenteral nutrition. In this case, or what you are concerned with, the biliary stasis is the amount, the length on how this bile it is going to be stored within the gallbladder. If there is obstruction due to some underlying conditions, which results in the bile to remain in the gallbladder for a long period of time, it is going to predispose it to start aggregation and also forming the stones. And pregnancy, the impact is the high levels of estrogen, which is going to result in the hypersecretion of the cholesterol. In fasting, it is just the same as in the rapid weight loss, just like we have mentioned, and a prolonged parenteral nutrition, just the same. So in this case, we are saying that the amount of time when this bile can be stored in the gallbladder, when it is prolonged, it can predisposes to the aggregation. They will be assembling and forming together to make these stones. And there could be other diseases that are underlining, like liver conditions, like liver cirrhosis, and the diseases of recession. In this case, we are talking about other underlying conditions that can lead to, like, infection. Infection itself, it can lead to inflammation, and inflammation due to the seepage or the fluids, it is going to result in the hyperconcentration of the bile, which is contained within the gallbladder, hence resulting in the formation of the stones within it. The sickle cell anemia. Sickle cell anemia, it is known to have the effect of high or excessively destruction of red blood cells, which increases the levels of bilirubin, which also have an impact on the cholesterol levels that are going to be found within the vessels, hence predisposing a person to have the stones within the gallbladder. Having looked at all that, we need to understand the pathophysiology. How does this alters the normal physiological function of the body in this case? So if you've noticed, we talked about number of factors that can actually lead to the formation of the stones in the gallbladder. So in this case, we're saying that the formation of the stones influenced by several factors that interacts together to result in the stone formation, or the condition called cholelithiasis. And we're saying that these factors are actually abnormal bowel composition, biliary stasis, and inflammation of the gallbladder. And we talked about the physiology on how this can actually lead to the formation of the stones. So we're saying that mostly 80% of the stones are primarily caused by the cholesterol, because we talked about the predisposing factors, and most of those predisposing factors, they were actually leading to the increment in the levels of cholesterol that results in the formation of the stones. And 10% of it, that's what is contained by the other substances, or the mixture of other substances that can actually lead to the formation of the stones. So the excess cholesterol in the bowel is associated with obesity, high cholesterol diet, and drugs that lower serum cholesterol, just like we have seen in under predisposing factors. So when these factors actually are present and they influence the occurrence of the stones, there's the supersaturated part with cholesterol, which can form the gallstones. So when we are talking about supersaturated with cholesterol, we're just talking about the increase in the production of cholesterol because of those mixtures of factors that we have talked about. So when those factors are present and there's an increase of the cholesterol, it is going to lead in the formation of the stones in the gallbladder. And we're saying that also the biliary stasis, which is the increase, or rather the prolonged amount of time where this bile is stayed in the gallbladder, can also lead to the formation of cholelithiasis. Not only the increase of the stay, but also the slow emptying of the gallbladder, which can be due to the partial obstruction that can be present within the biliary tree, can result in the cholelithiasis. So the stones that do not form when the gallbladder empties completely in response to hormonal stimulation. So what we are saying, when the gallbladder actually it is stimulated by the impulses from the presence of the food that can reaches the intestines, there will be no stones formation, because the bladder can easily empty its contents, and all what we are concentrated in is the failure of the bladder to release its contents, which is the bile in the intestines. So the slow or incomplete emptying, it is going to arouse the concentration of the cholesterol, and also increases the risk of stone formation. Remember, we said that due to the long stay of this bile, it results in the reabsorption of the fluids from the bile into the blood vessels, and this is actually going to increase the concentration of the cholesterol and leading to the formation of the stones. So inflammation of the gallbladder, it also allows the excess water and the bile salts to be reabsorbed and increases the risk of lithiasis. I guess this is just what I'm just from talking about in this case. And most of the gallstones are formed in the gallbladder, and after they are formed within the gallbladder, they are going to start circulating and migrating from the gallbladder into the biliary tree or in the ducts that actually aids in the drainage over the bowel. And when this happens, it is going to result in the inflammation of the ducts where those stones will be passing through. And the condition that is caused by that inflammation, it is caused as cholangitis. So when you hear the term cholangitis, we're just talking about the inflammation of the ducts. And some people with cholelithiasis, sometimes they remain asymptomatic. Why is this happening? Because actually the symptoms, they only depending on the size of the stones that have been formed. So when the size of the stones are that there which can passes through the biliary tract without without obstructing the biliary tract, it means that the person will have the formation of the stones without presenting the signs and symptoms that can clinically be detected. And now it leads us to the part of the signs and symptoms, so that we can see how this as stones can actually present with. So just like we have mentioned, it is possible that sometimes these signs and symptoms cannot be seen due to the fact that there's actually reduced this or the size of the stones, which can easily pass through the biliary tree, or sometimes if they form the partial obstruction or the biliary duct, it means that at least the amount of bile will be draining into the intestines in order to aid in the digestion or the fats. But sometimes when actually there is a complete obstruction, these are now the signs that you are going to see. So there will be epigastric distress, like a feeling of fullness or abdominal distension due to the increment or enlargement of the bowel bladder or the gallbladder. And there will be the vague pain in the right upper quadrant or the abdomen, just because this is where the gallbladder is located. So it is going to denote the location of where the problem is coming from. So due to the inflammation that is going to result in the gallbladder, it is going to result in pain as one of the signs and symptoms of pain of inflammation, so to speak. And if a gallstone obstructs the cystic duct, in this case we are talking about the ducts that actually comes from the bladder. When actually there's a obstruction, then it means that the bladder itself, it is going to become infected and distended, in a sense that when it is infected, fever can also result. That is going to rule the presence of an infection due to the stimulation of hypothalamus and for antibody antigen reaction. And also there will be distension of the gallbladder, and this is going to result in the palpable abdominal mass due to the increment of the size of this gallbladder. And the patient is also going to experience the biliary colic with excruciating pain, abdominal pain that actually radiates to the back or right shoulder, and is usually associated with nausea and vomiting. How is nausea and vomiting actually involved in this case? Due to the fact that the gallbladder, that we've seen from its anatomy part that there's actually a relationship between the gallbladder and the intestines. So when the intestines, there's an impairment in the intestines in terms of the digestion, it means that there will be nausea and vomiting that is going to result due to the fact of the impairment that has actually occurred. So these are some of the signs and symptoms that can be seen in the gallbladder disorders, specifically when you're talking about cholelithiasis. Investigations that can be taken in order to rule for the presence of this condition: you can do abdominal x-ray, which is going to detect the over distension of the gallbladder. You can also do specific cholecystography, that is going to show the function of the gallbladder, and it is going to show the abnormalities and the presence of these stones within the gallbladder. And you can also do the percutaneous transhepatic cholangiography. This one, it is going to look for the function of the liver. Remember, we talked about the impairment in the liver, which can be the overproduction of the cholesterol, and also the excess production of the bilirubin that can result in the presence of sickle cell anemia and other underlying diseases that affects the blood. This also, it is going to detect or show the problem that can affect the biliary tree, which is in this case the gallbladder that you're talking about. You can also do the ultrasonography. This is actually the technique that uses the echoes to detect the function or the problem that can occur in this case of the gallbladder. In terms of the treatment is going to be it is going to focus much on the cause of that the gallstones, because we talked about a number of causes. So even the treatment is going to be directed on those causes. So for example, in this case, we are saying that due to the presence of the stones, sometimes the visodeoxycholic acid can be given, or lithotrips, in order to dissolve the presence of those stones, because the stones are just the aggregation of the substances within the gallbladder. So the drug that is essential for dissolving those stones in order to combat the presence of the obstruction can be given, and in this case is visodeoxycholic acid. And also we're saying that mostly with these drugs, they can be given for a long duration. Like for example, for a period of 2 years, the person can be managing that condition of the presence of the stones in the gallbladder. Another type of treatment can be the supportive and the dietary management, because we talked about mostly this condition is caused by dietary problems. So you can actually use the dietary management as the combination of the problem cholelithiasis. So in this case, we are saying that about 80% of patients with gallbladder inflammation, they feel relieved actually with rest or intravenous fluids and analgesia, and also antibiotics, due to the fact that sometimes it could be the presence of an infection that is leading to this. So antibiotics can work in order to combat the underlying condition. If patient does not have the deterioration over the condition, it means that surgical intervention may be delayed. Only if at all there is a severe obstruction of the biliary system can the surgical management call for attention. And the diet, immediately it has to be limited, so that the person can avoid be taking the high fat diet, because in the high fat diet it actually increases the cholesterol levels. Hence, to avoid this, when a person is having the problem with gallbladder, it means that actually the diet also, it has to be limited to low fat diet intake. Also, you can supplement the intake of proteins and the carbohydrates that actually are going to help in the digestive system, unlike it is with the fats that cause for the presence of the bile. In terms of the pharmacological therapy, you are going to give the chenodeoxycholic acid, which is actually be responsible for the dissolving of the bile stones, or the stones that we have been talking about. And you can also these are actually the very drugs have got the capability of inhibiting the liver from synthesizing and secretion of the cholesterol. Having said that, actually cholesterol is the primary cause of the bowel or the gallstones, then you are going to give these drugs which are going to limit the synthesis and the secretion of the cholesterol, so as to avoid the hyperlipidemia. In terms of surgery, just like we have mentioned, surgery sometimes it is only necessary if at all the person has been having the long-term signs and symptoms of the bowel obstruction, and the inflammation of the bowel or the bowel gallbladder. When it persists, that's when a surgical management can call for attention. And we are saying that mostly with this one, the surgery that is going to call for attention, it will be an elective surgery that is going to be programmed when it is going to be done. only if at all it becomes as an emergency. That's when the surgery can be done just there and then. In this case, what are some possible complications that we can see in a person who is having the gall bladder stones? First one, it is the infection. Infection can result due to the fact that these stones can result in the obstruction of the bowel system. So due to the stasis and inflammation that takes time for a long period of time, it may result in infection. It can also lead to hypostatic pneumonia due to the fact that there's a relationship between the gallbladder and the liver there, together with the lungs. Hence, the infection can be spread even to the lungs and causing pneumonia, which is the accumulation of air within it. And it can also result into atelectasis. Atelectasis, in this case, it is actually the closure or obstruction of air reaching the alveoli, which leads to the collapse of the alveoli or of the lungs at large due to the infection that can be spread even to the distant organs due to the presence of the gallstones. It can also lead to thrombophlebitis. Thrombophlebitis, in this case, is the clot that can be formed within the blood, and also as it is circulating, it can cause an inflammation of the blood vessels. How will this clot be formed? Because we talked about the issues of the destruction of the red blood cells that can result in the thrombus formation and leads to the inflammation of the blood vessels. It can also lead to jaundice. Jaundice is also going to come from the destruction of the red blood cells, which actually increases the production of the bilirubin, and this bilirubin is the one that is going to result in jaundice in this case. It is also going to result in peritonitis as one of the complications. Peritonitis, in this case, is just an inflammation of the peritoneum or the abdominal cavity due to the fact that even this gallbladder, it is in the stomach, or rather, sorry for that, in the abdominal cavity. So having that it is in the peritoneal cavity, and the infection is going to be spread to all parts of the cavity and leads to peritonitis. It can also lead to steatorrhea. Steatorrhea, in this case, is just a condition where there's an impairment in the digestion of the foods that are being ingested, and results in the oily flow and smelly flow of the stool, and it actually results in the deficiency of the nutrients because there is the maldigestion of the nutrients that have been ingested. And this has been the end for today's lessons, friends. Thank you very much for your attention and for your time. Understand the condition and go through over and over so that you can easily get the concepts and be able to know how you can manage the condition if at all you've come in across the patient presenting with the problem cholelithiasis. Thank you for your time.